In the modern society, healthcare information system plays a critical role in defining the quality of healthcare offered in healthcare centers. Eder defines healthcare information system as any system that captures, stores, manages or transmits information related to the health of individuals or the activities of organizations that work within the health sector. It plays a critical role in ensuring that patients' data is captured, processed, stored, and retrieved in a simple way. In the past, this data would be captured, stored, and processed manually. The process of retrieving data was also very complex. However, the use of technology has simplified the entire process. It has made it possible for nurses and doctors to share data simultaneously without necessarily being within the same room. Healthcare information system has simplified the work of nurses. They can now review patients' details and determine the appropriate course of action in a very simple way. As Tan says, the impact of healthcare information system on nursing can be looked at from various angles. From filing, processing, and sharing of data to communicating with the doctors and other stakeholders, nurses find this system very beneficial. It has improved healthcare system in a significant way. Topic examples. It is important to look at some of the examples of areas where healthcare information system plays critical role in healthcare and nursing care. According to Tan, one of the best examples of nursing care tasks that have been simplified by this system is data processing and management. Every patient that visits any healthcare institution must have his or her details properly captured. Instead of using paper to file such data, technology has made it possible for the nurses to capture the information electronically. Once captured, the information is then transferred to the right department where the patient is to be attended. The doctor will then diagnose the patient and review the data initially captured and process the information for the patient. The processed data will then be made available in the system. In case the patient needs any lab test, the doctor's report will be available for the lab technician to read and understand what needs to be done. The information is then fed into the system. The doctor will be able to access the report without any file being moved into or out of his office. The doctor will then make the necessary treatments and recommend medications for the patient. The information will be reflected in the system so that the pharmacist can know what to offer the patient. This approach of managing and sharing data helps in reducing the amount of time taken to attend to patients. Healthcare information system helps nurses to share knowledge and new findings in their respective areas of work. Nursing as a profession is evolving, and the role of a professional nurse has significantly changed over the recent past. Nurses need to share information in order to make it easy for them to deliver their work effectively. This system makes it possible for them to share data without having to meet physically. Through this system, researchers in the field of nursing can also share their findings with the nursing practitioners and engage them actively in enhancing nursing practice. Personal experience. I have personally worked as a nursing unit clerk in one of the local healthcare institutions. The work there was very demanding because I had to handle numerous patients every day. The process of physically capturing the data was complex and time-consuming. We had to work closely with another clerk who would take the files to the doctors. The coordination among various specialists was very poor. However, things changed when the institution adopted healthcare information system. Capturing patients' data electronically was simple. This data was also made available to the doctors in real time without having to move from one point to another. Although making corrections while using this system required approval of several officers, my job was greatly simplified and improved. Mistakes made during data entry were significantly reduced. The system was very motivating to the entire workforce. The constant movement of healthcare specialists that was previously common was significantly reduced. Complaints from the clients also became minimal as the speed of attending to them improved. The pressure that was on the workforce became less, and the need to hire more nurses no longer existed. It was a great pleasure working with the new system. Conclusion. Healthcare information system has increasingly become a critical system in any healthcare organization. It simplifies the process of capturing, processing, storing, and retrieving data. The emergence of this system has completely eliminated the use of paper and physical files in these institutions. The quality of services offered in institutions that have embraced this technology has also improved significantly. As shown in the above discussion, healthcare information system is defining the future of healthcare in the coming days. Institutions that are yet to embrace this technology will be forced to find ways of adopting it. This and many other essays are available at studycorgi.com.